Did you know that sharing a toothbrush could potentially expose you to infections, including HIV? While HIV is primarily transmitted through sexual contact and blood exposure, certain personal hygiene habits could unknowingly increase risk. Could your toothbrush be putting you in danger? Let's break it down. We all know that good dental hygiene is important for preventing cavities and gum disease, but what if I told you that it could also play a role in infection risks, including HIV? Many people don't think twice about borrowing a family member's toothbrush or using an old one past its recommended lifespan. But what if small amounts of blood left on a toothbrush could serve as a transmission route for infections? Today, we're diving deep into the connection between poor dental hygiene and HIV risk, separating fact from myth and discussing the best hygiene practices to protect your health. When it comes to HIV transmission, there are a lot of misconceptions. Most people associate HIV with transmission through sexual contact or needle sharing, but what about personal hygiene tools like toothbrushes? Here are some common myths and misunderstandings. Myth number 1. HIV can be spread through casual contact, like sharing food or drinks. False. HIV doesn't survive well outside the body. Myth number 2. A toothbrush can't carry the virus. False. If blood is present and enters an open wound, there could be a risk. Myth number 3. HIV dies immediately once exposed to air. Partially true. While HIV doesn't survive long outside the body, in certain conditions, it can remain active in small amounts of blood. The question remains: is sharing a toothbrush actually risky when it comes to HIV transmission? Let's look at the science. The scientific basis of HIV transmission revolves around direct blood-to-blood contact, which is why sharing needles is a well-documented risk. But what about toothbrushes? Here's what happens when you brush your teeth. If your gums are inflamed or bleeding, which is very common, especially with gingivitis, small amounts of blood can remain on your toothbrush. When someone else uses the same toothbrush, there is a chance that any open cuts or sores in their mouth could allow direct blood exposure to any potential viruses. Key risk factors of poor dental hygiene and HIV exposure. Bleeding gums. If someone with HIV has bleeding gums, their toothbrush could contain traces of blood. Reusing or sharing toothbrushes. This increases the risk of any infectious material being transferred between individuals. Improperly cleaning or storing dental items. A damp toothbrush stored in a shared space could harbor bacteria or viruses for a short period. Dental procedures without proper sterilization. In rare cases, using contaminated dental tools, if improperly sterilized, could pose a risk. HIV does not survive well outside the body. However, studies show that under certain moist conditions, such as a recently used toothbrush left in a damp environment, the virus may survive longer than expected, especially if blood remains present. While the overall risk is very low, experts still strongly discourage sharing personal hygiene tools to eliminate even the smallest chance of cross-contamination. So, how real is the risk? Let's look at a real-world case study that raised concerns. There have been rare but notable cases where researchers investigated the potential role of dental hygiene in HIV transmission. Case study. A family's unintentional exposure. In one documented case, a child was diagnosed with HIV despite no history of high-risk behaviors. After ruling out other causes, investigators found that the child had been sharing a toothbrush with a parent who was HIV positive. The parent had bleeding gums due to gum disease, and although the exact transmission route was not confirmed, this case raised awareness about the potential risks of sharing personal hygiene tools. What do experts say? CDC and WHO recommendations. There is no confirmed widespread evidence that HIV is commonly transmitted via toothbrushes. However, the recommendation remains clear: never share personal dental hygiene tools, especially if blood exposure is possible. Dental professionals agree that oral hygiene is crucial for people living with HIV, as they are more prone to gum infections, which can lead to bleeding and increased risk of exposure to other infections. The takeaway? While HIV transmission through a toothbrush is extremely rare, it's still a possibility that can be completely avoided with proper hygiene practices. To sum it up, here are the key points to remember about poor dental hygiene and HIV risk. HIV requires direct blood-to-blood contact for transmission. Sharing toothbrushes can expose individuals to blood, which may increase risk, especially if gums are bleeding. The best prevention method is simple. Never share personal hygiene tools like toothbrushes, razors, or dental floss. Good oral hygiene is not just important for dental health. It plays a role in preventing infections and reducing overall health risks. While the risk of contracting HIV from a toothbrush is low, maintaining proper dental hygiene and personal hygiene practices is a simple way to protect yourself and others. What are your thoughts on this topic? Have you ever considered the risks of sharing a toothbrush before? Let me know in the comments below. If you found this video helpful, hit the like button, subscribe, and check out my next video on common health habits that could be putting you at risk. Stay informed, stay safe, and see you in the next one.